Jasmine here. So this is my second video of Parkinson's 101, where I teach you scientific things about Parkinson's disease. But I'm actually going to sort of take a little break from science here and talk about how to work with the scientists in charge, how to work with the doctors and make the most out of your doctor's visits. Whether that's getting a diagnosis, finding an answer to a problem that you're having with your current disease, or just regular checkups, regular appointments with your doctors and neurologists. And I'm calling this also known as how to make your doctors not suck. Because let's be real, everyone who's chronically ill has seen a doctor that is just awful, or has just, even the good doctors has just had a hard time communicating with them and they misunderstand you. My little disclaimer here, it doesn't work for everybody. Some doctors are not savable. But let's talk about how to work with the good ones. So, 7 years ago, I was just a 14-year-old with an undiagnosed chronic ill condition. And so seeing doctors and going from doctor to doctor and trying to communicate my symptoms and having a series of misdiagnoses, that's really sort of taught me how, I made a lot of mistakes in there, definitely. And learning from them has sort of really taught me how to communicate with them. And so I've sort of developed this approach that I want to share with you. So let's start from when you walk into the office and the doctor says, "How are you doing?" And you're like, "Oh, I'm fine." No, you're not fine. You're at a doctor's office. Of course you're not fine. And I really hate formalities in general, but this one's particularly can just really halt the conversation. Use this as an opening. When they're saying, "How are you doing?" You can say, like, "Today's all right, but, I'm having XYZ," or, "Today's not so great, this is happening." Like, use this to lead and start off strong and just go for it. The other thing I want to talk about is using descriptive words. So there's definitely what you're saying and what the doctor's comprehending may not be the same thing. So doctors have a very big medical lexicon they've studied for years, and they, have all these terms that mean something very specific to them. So if you say what you think you're feeling, and it's sort of kind of not exactly the medical term, they might not even really understand what you're saying. And so really what I've found to do is just try to be as descriptive as possible with your symptoms. And really try to get the doctor to talk back to you. Kind of be like, "Do you understand what I'm saying?" And see what they say. If they can say it back in their words to you, what they think is going on. And you can have that back and forth, and you can really get them to understand exactly what. And then they understand what you're saying, and they understand and they know they understand what you're saying. That can really help them figure out what's wrong and figure out a solution. Like for me personally, I sort of described my early symptoms, the pain that I was feeling as kind of like a tingly, like pins and needles, but without like the numbness. And for some reason, all my doctors just could not wrap their heads around the idea of that feeling, like separating the numbness from that specific tingle. But that's what I was able to describe it as. Whereas really, if I had kind of gone deeper into, communicating with them, I could have gotten them to understand that. And so that kind of led them down the wrong path of the diagnosis for a while. They thought I had some sort of neuropathies, which really wasn't the case. And so questions. Question your doctor. It's okay to be a pest. Don't be afraid to "Oh, I'm going to bother them." Like, no, you're not. It's their job to help you. So get them, and if you have questions, you can email them or call them. But also, if they make a decision and you don't really understand like what's going on, like what is this MRI for? What is this test for? Make sure that they ask them to explain it to you and really get them to talk to you about what they're doing. And that way you can be a really active participant or participant in your care. The other thing to do is really to get them to kind of like, if you can get them to think out loud, that's really helpful personally, for me personally. Like when a doctor's kind of going through treatment ideas and they're kind of thinking it through, then I can kind of be there with them as they do that, and that's really helpful for me. Also communicate with other patients because, patients do kind of know best really about certain problems. You might be having the same problem with somebody and they've already gotten an answer. The other thing, stay away from WebMD. Just don't do it. Card on this. Don't. Just no. WebMD is awful, and it's going to tell you that you have some, crazy cancer that 1% of the Moroccan people get, and you're here in California. But no, it's with WebMD, the problem is you really sort of type in symptoms, and it just generates a huge list of things with symptoms, and you can say leg pain. There's 133 possible combinations, and you might go down and you might click a disease that has some similarities with you, and it's just going to list symptoms. But here's the thing. Where's leg pain coming from in this disease? That's what's really important. If you're trying to figure out kind of investigating a little bit on your own, like what you think might be happening, you really need to think about the root cause. the root cause of your disease. So think about classifications of diseases. Think about where they come from. Okay, if I'm having leg pain, is it coming from my nerves? Am I having other nerve symptoms with that? Is it coming from the muscle? Do I have wasting or weakness? And then that way you can really understand like both where your doctor's coming from, and if your doctor has not really come up with anything and you kind of want to bring a couple solutions to them, if you really think about the root cause of your problem, that also helps you talk to them, being like, I think this is coming from here. That's important. And so documentation of your symptoms. When you're having symptoms, you go to the doctor's office for 30 minutes. Your doctor isn't going to see all of your symptoms in 30 minutes, and you can describe them, but a video is worth a million words. If a picture is worth 1,000, video is worth a million. If you can show them exactly what your symptoms are, like say, if you're having sort of a trouble when you walk at times, and you take a video, they can look at the video for them, and they have trained eyes. They might see something that you're missing that you're not able to describe. So if a video plus a description is the best way to get your doctors to really understand your symptoms. The other thing to do is document and chart and journal your symptoms and really sort of look for patterns, because patterns can really be a big diagnostic tool. And then the other thing too is just if you come up with questions during the time you're not at the doctor's office, write them down, because I promise you'll forget them as soon as you get to the doctor's. So when you're actually at the doctor's, I have a little card here on what not to wear. So there's a couple of things for the hospital that's really important. It's not a fashion show. Don't wear nail polish, because looking at the beds of your nails can be a diagnostic clue as well for some conditions. Don't wear makeup for the same reason. Yoga pants are your friends. You want to be able to, especially if you have some neurological stuff, you want to be able to pull the leg of your pants so that doctors can do different things. Shoes that easily come off is a really good idea too. Sweaters that are not pullovers, because let's be real, they're going to take your blood pressure. And if you're a woman, wear a bra with no wire, because that way if you have to get an x-ray or something, or some other test that requires magnetism, you're good. Okay, so I'm going to kind of talk about now a little bit of when you want to see a new doctor, because there are some doctors, like I said, that are just really not worth saving, and it can be very dangerous to have a bad doctor. So I put out the question there. This is sort of the fun part of the video. I put out the question to some of my friends with Parkinson's. What's the dumbest thing your doctor ever said to you? And they came up with great answers. One personal of mine, I was in the ER once with the Parkinson's freezing spell, and the doctor refused to give me the medicine that I told him works. But he gave me some Valium, and that did help, but it just made me really groggy. And he comes in and he's like, "Are you running around yet?" And I'm like, "I can barely walk when everything's working. Like, are you serious?" So, okay, I had a friend who was wearing running shoes to appointment, and saw the running shoes and said, "You can't have walking shoes." Never mind the fact that running shoes are just comfortable, and when you have problems walking, you want comfort. Another friend who has dystonia had curled in toes, and the doctor insisted that she was just anxious, gave her anti-anxiety medicine, and was so surprised when her toes didn't stop uncurling. This is one of my favorites. I have a friend who has Parkinson's, and her doctor every time says, "How's the MS?" And she's like, "I have PD." So, they're just not paying attention. And when they're not paying attention enough to read your chart before they see you, or if they've seen you before and they just are getting your wrong diagnosis, that's a problem. Another friend who had a side effect to a med that was, listed everywhere as a side effect, and the doctor says, "Oh no, I'm not going to take you off that. Like, that's not a side effect. It's just you." Okay. Someone was suggested that some jumping jacks would help Parkinson's. She could barely get off the table. You don't have walking issues. Your genes are just too tight. At least it's not fatal. Really. If it wasn't for your PD, you'd be very healthy. And everyone's favorite, it's all in your head. If your doctors say things like that to you, it's time to get a new doctor. They're not worth saving. And so the other things that people were telling me were just, doctors being just total jerks about bedside manner, giving them horrible news, and just, being completely unsympathetic and understanding. Your doctor really does need to care, otherwise they're not going to be invested in your treatment. And if they're ever downplaying your disease, get a new one. You want somebody who's going to be an active partner with you in this, and you want your team to be working together with you and including you in your care. Otherwise, you're going to have problems. And so, yeah, care is never over. When you get diagnosed and you're at that stability point, sometimes doctors can get a bit lazy with your care. You see them every couple months, and if you're stable, and they're kind of like, okay, just keep doing what you're doing, you want them to be really active and, not to get that sort of laziness factor. And that's really on you too. Really, it's important to challenge your doctor and say, okay, things are going this good. What about this? Is there anything else we can optimize? Because care is a constant a constant thing. It never does end when you have a chronic illness, so don't forget that either. And some doctors are just really awful. But good doctors can change your life. And it's just a constant fight. You really have to be your own advocate. And just keep going and just push it, and you're going to be okay. You just need to keep doing it. Chronic illness is hard. It's okay to be very frustrated with the medical field sometimes, and to just think things are never going to happen. But never give up, because health is out there. And so those are my tips to making the most out of your doctor's visit. I wish you all the best outcomes and the best care you can get. And I wish everyone could have. I wish I could gift my care team to people sometimes. But there are more good ones out there. So keep looking for them, keep challenging your doctors, and keep being an active participant.